So that's the spine of the scapula. Supraspinatus, infraspinatus. What supplies those muscles?
Suprascapular nerve.
Very good. Where do they come? Where does it come from?
From the first trunk.
Very good. From the upper trunk. From the upper trunk, you also have something called the suprascapular nerve. The suprascapular nerve supplies the supraspinatus and the infraspinatus. Okay. Sorry, Johnny. One more time, please. Just turn on to that. Okay. So that's supraspinatus, infraspinatus. Okay. That's the edge of the scapula. What muscles are these? Teres minor and teres major. Okay. So teres minor is up there. Teres major is up here. Okay. Nerve supply to teres minor.
Axillary.
Very good. Teres minor is by axillary and teres major is by lower subscapular. Okay. So the lower subscapular nerve, the lower subscapular nerve supplies subscapularis as well as teres major. Axillary nerve supplies deltoid as well as teres minor. Okay. And then you have radial nerve. So the radial nerve supplies the triceps, I said. So the radial nerve, that's, you can see the spiral groove in him quite nicely. So that's a spiral groove. Comes down. That's the brachioradialis. If you reflect the in the cubital fossa, if you reflect the brachioradialis, you will see the radial nerve there. Okay. Then it lies between the two heads of the supinator muscle. It runs between the two heads of the supinator. There. Just turn towards them for a minute. And about 7 centimeters distal to the joint line, it divides into what? Posterior interosseous nerve and superficial branch of the radial nerve. Okay. So at this point it divides into a posterior interosseous nerve, which is a deep branch, similar to your anterior interosseous nerve, which is also a deep branch. And then you have the cutaneous nerve, which is called the superficial branch of the radial nerve. That's what you're testing for sensation. Okay. Now, posterior interosseous nerve. Nerve injuries, you will get a full EMQ on nerve injuries. So the favorite questions are related to levels of nerve injuries. Imagine your radial nerve is injured at this level, above the spiral groove, then the entire extensor aspect is paralyzed, quite obvious. If it is below the spiral groove, triceps is spared. Okay, so the patient will have extension of the elbow, but wrist drop below the spiral groove. Okay, let's go slightly lower down. At this level, what muscles are spared? Triceps is spared, fine. Anything else? Which one? Brachioradialis is spared because the brachioradialis is supplied earlier than that. Then you have the anconeus, which will be spared. You probably will also have the extensor carpi radialis longus and the brevis, which extends the wrist this way. That is also spared. When you come down, the posterior, before it gives you the posterior interosseous nerve at this level, always the extensor carpi radialis longus, extensor carpi radialis brevis, anconeus, supinator and brachioradialis, they are always supplied. So if the patient has got a posterior interosseous nerve injury following a laceration, patient won't have a wrist drop. Patient will be able to lift the wrist up, but there is loss of extension of the fingers. Okay, so if you get a clinical scenario whereby they have all these different nerves, and then the question says patient is able to extend the wrist, but not the fingers. Which nerve is it? It's not the posterior interosseous nerve. Okay, it's a posterior interosseous nerve. And the question will be a bit more specific. It will say the patient is able to extend the wrist, but with a radial deviation, because only the extensor carpi radialis longus and brevis is working, not the extensor carpi ulnaris. So when the patient extends the wrist, they say it radially deviates. Because when you're extending the wrist, you have the extensor carpi radialis on the radial side and the extensor carpi ulnaris on the ulnar side working to extend it. So if posterior interosseous nerve is injured, the extensor carpi ulnaris is affected, but not the radialis. So the patient can do this, but it will deviate to the radial side. Okay. Staying on the radial nerve, it supplies all the other muscles in the hand. The thumb, what they're going to ask you, you should clearly know the names: extensor pollicis longus, extensor pollicis brevis, and then you have the abductor pollicis longus in the base of the snuff box. Then to the digits, you should know the names: extensor digitorum communis, extensor indicis, and extensor digiti minimi. Okay. So there's no really an EMP question on that, but you can get a question on the snuff box. Boundaries and contents of the snuff box. Boundaries of the snuff box.
So EPL.
Yeah, very good. On which side?
On the ulnar side.
Ulnar side. On the ulnar side, you have the extensor pollicis longus.
And then is EPB on the radial side.
Extensor pollicis brevis and.
I can't remember.
Abductor pollicis longus. So 2 longus and 1 brevis. On the ulnar side, this one, lift the thumb up for me, please. Yeah, just lift the thumb up. Yeah, very good. See, that's it. So that's your extensor pollicis longus on the ulnar side. That's extensor pollicis brevis. And then here is the abductor pollicis longus, which abducts the thumb. So those are the boundaries of the snuff box. Okay, what are the important structures here of the snuff box? So superficial branch of the radial nerve. Radial artery. Radial artery is deep. Okay, radial artery is deep, and cephalic vein. Cephalic vein. They are in the snuff box. Okay, what are the bony prominences you can feel in the snuff box? If you feel your snuff box, clearly you'll feel your scaphoid. What else can you feel? No. Trapezium. Scaphoid, trapezium, 4 bones. Scaphoid, trapezium. Anything else? Base of the first metacarpal and the radial styloid. Okay, these are the 4 bones in the snuff box. That's the radial styloid.
That's classed as in the snuff box, is it?
Yeah, that is because if you look at the anatomical specimen, the radial these tendons lie on the sides. Okay, so that's a snuff box. Right. So that's all about the radial nerve. Now if I go back here, lift your arm to the sides, please. That's your teres minor. Where does the teres minor insert? Greater tuberosity of the humerus. Okay, what else inserts along with the teres minor in the great?
Supraspinatus.
Very good. So supraspinatus, infraspinatus, teres minor. So the rotator cuff muscles. So SITS, S-I-T-S, supraspinatus, infraspinatus, teres minor. They are attached to the greater tubercle, and the subscapularis is attached to the lesser tubercle. Those are the rotator cuff muscles. So that's the teres minor. Sorry, this is a teres minor. Where does the teres major insert? Think about it. I'm sure you know this. If you can see the arm, the teres major coming from there, where can it insert? Think about it. It has to be in the shaft of the humerus. Where else can it go to? It has to be, isn't it? Because if it is not going to the shoulder, it has to be coming here. So it attaches, inserts into the medial lip of the bicipital groove of the humerus.
You just completed your first video of the world's best medical exam preparation. Lecturio brings the knowledge of worldwide leading medical experts and teaching award winners to your PC, tablet, or smartphone. Prepare yourself and check your progress with thousands of quiz questions, customized to USMLE standards. And the very best, you can get in touch with our medical experts personally. Visit lecturio.com now and continue with the most inspiring medical education around the globe, anytime, anywhere.